what if the whole thing turns out to be, hey, this is worse than whatever. It's doing nothing. It's like oat bran.
Right.
Remember the oat bran thing? I'll tell you what's not oat bran is my good friend Dr. Elliot Goldstein. He's the CEO of Promise Neurosciences. The more I follow this company, the more I realize these guys have something really cool going on here. They have identified what they call a novel antibody for Alzheimer's disease.
Nice.
And it's fascinating because it's having elderly parents. I mean, we all have parents, but they are attacking this disease, and this is the only top 10 cause of death that doesn't have a treatment. Dr. Goldstein, how did I do there? Did I set that up perfectly or what?
Very well done, Sully. Pleasure to speak with you today.
Great to talk to you, too. Talk about this public health issue once again for people who haven't seen you, because we picked up a couple of new affiliates. Talk about the public health issue that is Alzheimer's.
Yeah, a couple of key facts. More individuals die from Alzheimer's disease than breast cancer and prostate cancer together. It's the sixth leading cause of death in the United States or in Western countries. And as you pointed out, it's the only chronic disease for which there's no underlying root cause therapy, although many of us are working on that, and there's light at the end of the tunnel.
I always think of Alzheimer's as more of a mental thing than something that could physically disable you.
But your mental, the mental faculties is caused by a very physical reaction in the brain. Why don't you take that one, Dr. Goldstein?
Yeah, so Alzheimer's disease, like many so-called neurodegenerative diseases, ALS, Lou Gehrig's disease, Parkinson's disease, there's many others as well, is due to the death of neurons, brain cells, progressive dying of neurons in different parts of the brain. What we've learned recently from many years of failed clinical trials and outstanding clinical science is that there are proteins, normal proteins in the brain, two in the case of Alzheimer's disease, that have a tendency to misfold. They clump up and misfold, and when they do this, they become toxic, they kill neurons, and they act like seeds corrupting normal protein in the vicinity. So these two proteins are amyloid, not amyloid plaque. We've learned that plaque is not toxic. It's a normal form of the protein. Something called amyloid oligomer. It's a little clump of 2, 4, 10, 12 strands of amyloid that's misfolded, kills neurons, and propagates the killing throughout the brain. We recently announced last week that we've also identified antibodies that are highly selective for the toxic misfolded form of another protein called tau, T-A-U. This protein is essential for neuronal function. It resides inside the neurons. So it's very important to have therapies like we're developing that are highly selective only for the toxic form of these proteins. Only the toxic form of amyloid beta, our lead product there is PMN310. It's close to going into clinical trials. And now, as we announced last week, we've identified selective antibodies for the toxic form of tau. So 2 quick points. Why do you have to be selective? Why not just knock out all forms of the protein? Keep it easy, keep it simple.
Yeah, boom.
Well, yeah, right? Blow up the whole neighborhood while you're at it. I mean, yeah. Well, the challenge with that is that not only do you knock out the toxic forms, potentially, but knocking out the normal forms can cause serious side effects and serious damage. So you want to stay away from that. Secondly, and very importantly, the toxic forms are present in very small concentrations compared to the normal forms. So if your product attacks all forms, normal and toxic, you're going to be wasting most of your therapeutic ammunition on the wrong target.
On the good stuff, potentially, right?
Exactly. So you want to be selective for the bad guys.
Okay, here's my question for you. So you guys have 40 plus patents for this novel way of making drugs that work on the targeted drugs. Talk about medical patents for us for a second, and talk about the benefit of that for you guys as a corporation. Promise Neurosciences, by the way, is the name of the company, and Dr. Elliot Goldstein is the CEO and president of the company. By the way, they're publicly traded under the stock symbol ARFXF. ARFXF is the stock symbol. I have it up on our website, and I tweet it out to our listeners when we have Dr. Goldstein on the air. Talk about the patent side of this one. This is interesting.
Yeah, so I've worked in big pharma for about 18 years, and then the last 20 years or so in smaller entrepreneurial settings. In big pharma, there's a really simple saying: you got to own it. If you don't own it, there's no value. So that's your intellectual property, your patents, and you got to be able to make it make it to high quality and cost effectively. That's your manufacturing. Everything in between is a lot of good science and difficult development. So the way the patents work is that it has to be a novel idea that's not obvious, that hasn't been presented or discussed elsewhere before. And when your patent is submitted, it has, if it's accepted in various territories, generally have about 20 years of protection. So if you put your patents out 4 or 5 years into the development cycle, you may have about 10 years of patent protection.
So basically, the clock starts sometimes before you want it to start. Listen, we're out of time today. I want to have you back potentially later in the week.